Well, good afternoon. It's great to be here at Holmes Regional Medical Center in Brevard County. I want to thank CEO Brett Esrock, and I also want to thank our Dr. Jeff Stallnacher, who's the Chief Physician Executive here at Holmes First, or Health First, and they're going to also make some comments. I think that if you look at what we're seeing on the ground, place like Brevard County, I think that we're seeing some positive momentum. Brevard had very, very low incidence March, April, May, into early June. Then, like the rest of the state, they started to see more prevalence in the community, whereas they had been testing 2 to 3% of people testing would be positive. We started to see that get into the double digits. 10, 15, 16%. Well, now if you look, Brevard's been in the single digits pretty consistently now for the past last 10 to 14 days. You started to see ED visits have declined, and you're seeing the hospitalized patient load stabilize, which we're seeing similar trends throughout the state. But I think it's really good to see that going on here in Brevard. So they're going to talk a little bit about what they're seeing here and what they're doing to be able to treat patients, but I think they've been really doing a good job. We, earlier this week, asked Floridians to consider giving blood if you do have antibodies from COVID-19, if you've cleared the illness, and we did that in conjunction with One Blood. We are seeing more interest in that. One Blood is seeing increase in traffic to their website and inquiries, and so I just would reiterate the use of convalescent plasma can help patients who are hospitalized due to COVID-19. So if you have the capacity and the wherewithal to do that, we would really appreciate it if you did. On many of our drive-through test sites that have antibody testing, you will get a result if you test positive, within 15 minutes. Go give blood. It's a good thing to be able to do, and we're really happy that many people are answering the call. Also happy, another good announcement in terms of the therapeutic drug, remdesivir. The hospitals had asked us to replenish the supply. So a couple weeks ago, we were able to get an expedited shipment, which was really important to make sure that the patients continue to have the care they need. We had to do that again, and so earlier this week, we had another 30,000 vials of remdesivir, thanks to the president and the vice president shipping that down to the hospitals here in the state of Florida. We want to make sure that the hospitals have what they need, that the doctors have what they need to be able to treat patients, and so we're getting another 11,000 vials to arrive at hospitals tomorrow. So that's a really good increase in the supply of the remdesivir for our hospitals. It's something that I think physicians have said has had a positive impact. So we want to make sure we're doing everything we can at the state level to get that in their hands. And I do thank the White House. I thank the President, Vice President Pence as well, for being very responsive to the need here. And we're going to keep doing that. It's important to know, state of Florida, we have capacity to help people, and they'll talk a little bit about it here in Brevard. But we've had between 20 and 25% of our beds available pretty consistently over the last month and a half, even as we've seen the census for COVID-19 patients increase. We've also had between 15 and 20% of ICU beds available statewide. We had an event a couple days ago just trying to explain that there's a number of hospitals that don't have this ICU at all, rural hospitals. There's some large hospital systems that may only have 1 or 2 beds at one of their facilities, but they have the capability to provide this level of care. So people should understand, obviously with COVID, but if you have other ailments, heart, stroke, don't sit on that. Go in and seek the care you need. They're going to be able to take care of you, and they want to make sure that we can do it. In fact, I think that pretty much universally, when you talk to folks who are running hospitals, they've got beds, they've got equipment, PPE. Obviously, we're working, making sure they have the therapeutics and the treatment. I mean, the one thing is just making sure that they have enough personnel. part of it is just the personnel have been worked very hard. This has been going on since March. It's taxing. And then also you have staff, if a staff member gets exposed or infected, they may have to isolate, so it becomes an issue. So the state has already deployed over 1,000 medical personnel to assist not only our hospitals, but also our COVID-only long-term care facilities. So we've been honoring requests, and we continue to stand by to help more. It's very, very important. One of the things I think that we've done and are continuing to build momentum on is support for residents in long-term care facilities. We now have what we noticed early on. Obviously, we limited visitation, required PPE. We sent huge amounts of PPE to the long-term care facility for the staff to do it. We tested members of the staff and the residents in April, May, early June, which we have over 4,000 facilities here in the state of Florida, so it's a big undertaking. But what we noticed was, okay, we weren't going to let a hospital discharge a COVID positive patient back to a nursing facility, but we also would have situations where someone may test positive at a nursing home, and that nursing home may not have the ability to appropriately isolate them. So we saw a need to develop these COVID-only nursing facilities, and so we now have 21 operating throughout the state that are COVID exclusive. We have 4 more pending, will likely be online by the end of the month, and that'll be a total of 1,700 beds. And so if you do identify a positive case in a nursing home, but that patient doesn't require hospitalization, you have a safe place where they can be isolated. If they're in the hospital but they're stable, this is a safe place for them to be discharged to without running the risk of expanding the spread to the most vulnerable in our society. And so that's been an important focus. I really appreciated the White House and the President announcing that they're going to be involved heavily in fortifying testing. What we're doing right now is, and we've already gone through one iteration of this, but we're testing every staff member who works at a long-term care facility on a biweekly basis. So that's over 200,000 people that are being tested every 2 weeks. Fortunately, the positivity rate has been about 3%, which is lower than it is in the community. At the same time, 3% of 200,000, that's about 6,000 staff members that have tested positive. And so, but we believe that periodic testing like that, routine testing, we could identify if a staff member has it, and that may be enough to be able to prevent it from spreading to the residents. So we're going to continue to do that. We're also dispatching incident management teams to all 4,000 plus long-term care facilities in the state to monitor infection control practices, screening of staff, sanitation, making sure they're wearing PPE. I mean, we've sent over 10 million masks, and we've sent massive amounts of face shields and gloves and gowns, and that's important, but obviously it needs to be employed properly. We did this at the beginning of the pandemic. We were able to help rectify some poor practices, and we're going to do it again just to make sure that we're doing the best we can. Most of these facilities have done a really good job of really sticking with this, and I think that's a testament to the fact that, while we have had outbreaks in these facilities, we've had fewer as a percentage than many other states, and I think that this is a big reason why. It's really important that we do that. Now, the federal government, they're going to be doing point-of-care testing. We're not exactly sure how that is going to shake out. We stand by to see that. But obviously, if you had a point-of-care test, when we're testing the staff, it's a swab, send to a lab, and the turnaround is good, about 36 hours, but that's much different, obviously, than point-of-care testing. And so if point-of-care testing is something that works and that is widely available, I think that would be good just generally, but I also think it would help in terms of allowing visitation into some of these facilities, which we've not done since the middle of March, and that's exerted a tremendous toll emotionally on a lot of people. It's been really, really difficult. So we're sensitive to that, and we would love to be able to get visitors back in these facilities, but just with the prevalence in the community now, even as we've seen the testing numbers stabilize, our percent positive is a little bit lower than it was two weeks ago. We were 15, 17%. Now we've been 11 to 13, and I think it is trending down, particularly in places like Central Florida, but where we are concerned about potential introduction of COVID-19 into some of these areas, and so we're looking at that every day. But I really appreciate what the folks in our healthcare system have been doing for many, many months. Got a lot of people who've been working incredibly hard. It's not easy dealing, with any pandemic, I'm sure. Heck, it's not easy dealing with some of the things they deal with on a routine basis apart from this. But I think just how intensive it is when you're dealing with a disease this infectious, for all the procedures you have to follow, everything you have to do, this has really been a lot of hard work, and a lot of people have done a heck of a job. So I commend people up and down the state for the work that they've done. I do think that we are going to head in a better direction here shortly. But in the meantime, just keep it up, because a lot of people are very proud of what you're doing. So it's an honor to be here. I want to bring up CEO Brett Esrock, Health First Home Regional Medical Center.
Good afternoon, everybody, and Governor DeSantis, thank you for being with us today. It's an honor to be able to host you here at Holmes Regional, part of Health First. Health First providers and associates have made it their mission to care for our community. These are our friends, our families, and our neighbors, and we take great pride and care in providing them wellness and health care they need, no matter what. Within our integrated delivery network, we have more than 9,000 associates. For our associates, healthcare isn't just a job. It's a sacred and honorable calling to serve others, and many times in the most vulnerable times in their lives. These associates, especially those on the front lines, have been tirelessly dedicated to caring for those stricken with COVID-19, and of course, as the governor said, many other illnesses that they come in with on a daily basis. Despite the stress of long hours, a virus that clearly we're all still learning so much about, and the strain that can surround a constantly changing and unsettling public health crisis, the character and dedication of our healthcare workers has proven the community should rest assured that they're receiving the best care possible. Everybody's in good hands here. Health First associates are a magnificent model of calm and compassion. It's something that many of us need right now as we're going through this pandemic. Many have shown flexibility and openness to additional training at a time that they can assure they're ready to go wherever they're needed across Health First. Just as we plan how we can expand availability of our beds, our capacity for breathing devices, we also plan for how we can support our associates and to meet the needs of our patients. These providers and associates have shown incredible courage and continue to do so each and every day. Their humble healthcare providers continue to throw themselves into their work every day, helping to protect everybody they can in our community and nurse those who are sick back to health. We're incredibly grateful for all their contributions to our community, to our society, and with their knowledge and skills and compassion, they're a shining light for all of us. Thank you for all that you've done for our community. Jeff?
Thank you, Brett. And I'd like to echo the same to my fellow physicians, nurses, techs, case managers, food service folks, our facilities folks, and I'm sure there are even more. We know you're tired, but you still do it every day. Thank you. I'd also like to thank those in our community that have chosen to wear masks and follow other guidelines that help to keep us safe. But maybe I'd like to talk a little bit about what we've done here at Health First to both prepare and provide services during this pandemic. We've consistently prepared for scenarios to ensure that we have the expertise, staffing, and facilities for those that come through our doors. We've been diligent in our planning. Health First is prepared and will continue to make any adjustments necessary to have the capacity, staffing, and tools that are needed. Our hospital occupancy rates vary throughout the day, and we have various contingencies to open additional units if we approach capacity. While occupancy rates are higher now than at the start of the pandemic, we have surge planning in place to expand our ability to provide care, and we shift patients as needed to assure that they're receiving the level of care they require. As we often say, we're one hospital with 4 locations. We can quickly construct more spaces to treat patients with respiratory illnesses, and we can transfer patients as needed. We have increased our specialized respiratory capability to 208 negative pressure beds. Some people have also expressed concern here in Florida and nationally about the availability of ICU beds. And it is important to understand that an ICU bed is not needed for every patient with COVID, but just those that are most severely ill. For us, that's about 23%. But a typical COVID patient can receive exceptional care in one of our respiratory units. We've dramatically expanded our supply of breathing devices since the pandemic began. We now have 1,915 devices that can be used to help patients breathe, and that's literally twice as many as we have beds. So we continue to maintain precautions at all our facilities to protect our associates, patients, visitors, include social distancing, plastic partitions and check-in areas, hand sanitizing stations throughout our facilities, universal masking, and strict disinfection and sanitation procedures. We also reinstated a strict no visitation policy at our hospitals when the uptick occurred, obviously with limited exceptions. And per CDC guidelines, we recently mandated that protective eyewear be worn in our clinical facilities as well. We will continue to have the capacity to treat COVID-19 and non-COVID patients. We're ready for this and we're safe. So please do not delay emergent or urgent treatment. We're prepared to care for you no matter what. Brevard County has depended on Health First for over 80 years and will continue the legacy of caring for decades to come. Thank you.
Well, thanks a lot. Would you say that the people that have delayed care, when now you're seeing them now, that their conditions are worse than had they come in originally? Are you finding that?
Particularly early in the pandemic in March and April, yes, we had people delaying care, and for a period of time, we also held on electives as we had enough PPE. We have that now, and we've continued now to do electives. So we're beginning to see folks come back, but yes, we did see delays in care.
Yeah, so I just, it's great to see, these folks in action, but also just making sure that people understand that the message of, the COVID is one aspect, but I mean, you go throughout Florida, most of the patients are not in for COVID. They're in for other things, and those ailments aren't going away. And if you do have symptoms, if you have heart problems, if you have stroke symptoms, they're here to help you. And if you go in and get that care early, you're going to be better off than waiting. And I think that when the country saw, and this was pretty much everywhere, a big drop in visits to the ED for particularly things like heart in March and April, and I don't think it's fully recovered yet. I think you guys are doing better than you were, but that's going to have some long-term health implications. And so they're open for business and they want to be able to serve folks. Also, just a couple things that I know people have been asking about. There was reports about Floridians signing up to take a COVID test, maybe deciding not to go or waiting in line and then just having to do something else. So they never actually got tested and then notified that they tested positive. We've looked at our state sites and we have not found examples of that, but I know most of the other folks who've talked about it, I think those were more private sites that they were talking about. But bottom line is it's something that we want to get to the bottom of. So if people have information, if someone sent you a letter or text message or an email saying that you've tested positive when you actually haven't taken a test at all, that's something that we definitely want to look at. We've not been able to identify that just in the sites that the state is running with the National Guard, but it's something that I think is really important to get to the bottom of. And then the other thing, just yesterday we made a statement about education and how important that is. Our kids are ones who, they're the least at risk for this by far. They're the least important in terms of transmitting the virus, and yet they've really suffered a lot under the control measures that have been put in place since mid-March. And so that is a real problem, and I believe we need to give parents the options to get their kids back into face-to-face. If a parent doesn't want to do that, then they should absolutely have the right to do distance learning. But the problems that will mount by keeping kids out of school indefinitely, I think will be really, really significant. And so as we deal with the coronavirus, we got to understand that there's still all these other issues in society haven't gone away, and we need to continue to keep our eye on the ball. So I think the approach of choice, parent choose, you should have a right to have face-to-face, but if you don't want to do it and you're not comfortable, then by all means, choose distance learning. And the same thing with the teachers. If I know a lot of teachers really want to get back in, if others are, have health problems or just they don't feel comfortable, let's just make do with what we have. I think you'll see a lot want to go, some won't want to go with the parents, and I think it can work out. But to deny people the ability to get in-person instruction, I think that will be very problematic, and I think that'll create a lot of problems that we'll regret in the months ahead. And with that, happy to take some questions.